Hello, I, Abhinav Pandey, am a first year MBBS student of Sri Sathya Sai Medical College, Tamil Nadu. And as a part of continuous awareness program, I am going to share with you some important knowledge about gout. So why should we study about gout? Gout is a most prevalent disease in old age people, in senior citizen mainly. Gout is generally a metabolic disease characterized by recurrent attack of acute inflammatory arthritis caused by elevated levels of uric acid in the blood, hyperuricemia, most common rheumatic disease of adulthood. However, hyperuricemia is not gout. So let's talk about risk factor of gout. Risk factor of gout are mainly raised serum urate level, age 2% in 45 to 64-year-old men and 6% in less than 75-year-old have gout. Gender, male and female ratio is 3:1. Diet and alcohol. Wine in moderation appears safe. 2:1. Now I will talk about types of gouty arthritis. First one being acute gout. Acute, it is acute, self-limiting, monoarticular, painful and red hot swell. Usually resolve within 2 weeks if untreated. May occur even if serum urate level is normal. Commonly affected joint are first metatarsopharyngeal joint, forefoot, ankle, knee joint. Let's move on to the second type, chronic gout. It is polyarticular arthritis and topy formation. Articular tophaceous gout may result in destructive arthropathy and secondary OA. Let's move on to the second type, chronic gout. It is polyarticular arthritis plus tophy formation. Articular tophaceous gout may result in destructive arthropathy. Tophaceous disease are more likely to occur in patients with polyarticular presentation, serum urate level more than 540 micromole per liter. Sites of tophy, digits of hand and feet, which is most common, pinna of ear, classic but less common, bursa around elbows and knees, and Achilles tendon. So how will we diagnose the disease? Two of the following criteria for clinical diagnosis are clear history of at least 2 attacks of painful swelling with complete resolution within 2 weeks, presence of tophus, rapid response of colchicine within 48 hours of treatment initiation, definitive diagnosis, presence of monosodium urate crystals seen in synovial investigations of gout. Specific investigation confirmation are serum uric acid level, joint aspiration and crystal identification. To detect medical condition of gout or hyperuricemia, serum creatinine urea, serum blood glucose, fast lipid profile. To detect complication, renal imaging and skeletal x-rays. Now coming towards the treatment of gout. Thiazide loop diuretics and low dose of aspirin are given to the patient. Low protein intake and low purine intake in the diet is necessary. So now let's talk about management of chronic gout. First line of treatment is mainly done by allopurinol, and second line of treatment is done by febuxostat and other drugs. Colchicine 0.5 mg twice daily is used for first 6 to 12 months initiating urate blower therapy. This brings me to end of my video. At last I want to say the very name gout has a ferocious frying sound like a growl of some remorseless monster ready to fasten upon his prey. So let's fight that monster. I hope my video was informative. Don't forget to like, share and subscribe.